Hello everyone. Today we will discuss about the approach to NAC OSCE epiglottitis. I am Dr. Nazish Munawar and this presentation is for educational purposes only. So first of all, I would like to talk about what is epiglottitis. Epiglottitis is inflammation and swelling of your epiglottis. The epiglottis is a flap of tissue that sits under the tongue at the back of the throat. It is life-threatening condition and it occurs in any age. Today we will discuss about the in pediatric children in pediatric age. So next I would like to discuss about the causes of epiglottitis. So there are different causes like infection, injury, lacking adequate vaccination. So in the past, a common cause of swelling and inflammation of the epiglottis and surrounding tissues was infection with Haemophilus influenzae type B bacteria, also called the HIP. HIP is now much less common in developed countries due to the HIP immunization in children. It could be due to the injury, so it could be due to if someone swallow a chemical that burns your throat, and it could be due to the swallow a foreign object, any smoke drugs such as the crack cocaine, all causes the epiglottitis. And the most common cause is lacking adequate vaccination. So next I will tell you that in the history it is very important point to ask about the immunization history of the children. So how we can diagnose about the epiglottitis? Basically, it is a clinical diagnosis and emergency condition. So if patient is unstable and drooling, so do not examine the patient throat and intubate and call the anesthetist and ENT specialist. For the diagnosis, after stabilization of the patient, we can also do the X-ray of the neck in the AP and lateral view to see the thumbprint sign. It is the indication of the epiglottitis. So this slide I would like to discuss that when you go for the NAC OSCE examination, you will get these candidate instructions on the door of the examination hall. And this slide will discuss about the 6-year-old male boy presented with difficulty breathing. His mother complains that he has noisy breathing and cough. In the next 11 minutes, obtain a focused and relevant history of presenting problem. Address the mother's concern. After 8-minute warning signal, the examiner will ask you questions related to this patient. Be noted, please. In the examination, no child will be present. Only the parent will relate the story. So, as we notice that there is a instruction regarding that in this scenario we have to ask about the history and address the mother's concerns. So first of all, this slide will outline what you can ask in the history. So first of all, you have to explore the chief complaint by asking the open-ended questions with the mother and discuss about that. In history of present illness, there is you can ask about the OCD, PQ or ST. It's a mnemonic. O stands for the onset. You have to ask about the onset of the chief complaint, like if in this scenario the patient was presented with the difficulty breathing and stridor, noisy breathing. So ask about when it started. So and ask about the course, like it was insidious or it was slow progression or it was sudden onset. In duration, you can ask about that how long it rests, and for the provoking, you can ask about the any things which make it more worse or make it better. So in provoking, you can ask about the sleep, any difficulty with exercise or wakefulness, and any difficulty with the feeding. In quality, you have to ask about the mother ask about the child to the mother that describe the sound, how it was, like it's high pitched, it's musical, it's wheezing, or it's inspiratory and expiratory. So it will help you to narrow down your diagnosis and differential diagnosis. So after that, you can ask about the severity. It is very important to ask about that. You can ask about the cyanosis, any respiratory distress, any gasping, any altered mental status. And after asking the severity, you can ask about the timing. So it is very important to ask about the associated symptoms to rule out any infection, because in the children it is very important to rule out infection. So ask about the fever, ask about upper respiratory tract infections, any changes in the voice, and drooling is most important in this case scenario. And ask about any difficulty with swallowing, and cough is acute or chronic. So must rule out all these things. So there are some red flags in this scenario. You have to ask if the patient, especially the pediatric patient, presented with the difficulty breathing and stridor. So must ask about the drooling and look at the position, or ask the mother that either the patient has tripod position when having the difficulties breathing, and there is any blue discoloration or cyanosis. It is very important to rule out the red flags. After that, you can ask about the past medical history. In past medical history, ask about the antenatal history, perinatal history, any previous intubations, any admission for the respiratory distress, or any episodes of the stridor before. Ask about recurrent infections, any heart problem, any chest problem, any genetic disease, or any inhalation history or trauma or burns to the neck. After that, you can ask about the past surgical history. In past surgical history, ask about any surgeries regarding the neck, throat, and any cardiac surgeries, and medications. In medications, in every case, you have to ask about if the patient is taking any medications, any pharmacological medications, over the counter, or any herbal medications. It is very important to ask about the allergies, because some children have some allergies, so we have to avoid them. So ask about any allergies to the medication, any food allergies, or environmental allergies. After that, ask about the family history. It is very important to see that either there is any history of the family history of any epiglottitis, or any chest problem, or any cardiac problems. Immunization history is very important in this scenario, because epiglottitis might be due to the lack of the adequate vaccination in the childhood. So must ask about the immunization history, and especially for the hip vaccination. Next, we will talk about the social history. In social history, you have to ask about the home, with whom the children lives, about the partners and parents, and ask about the home and environmental allergen exposure, any sick contact at home, any secondhand smoke, and how is the relationship with the child. It is very important. And then developmental history. You have to ask about the milestones of the children from the earlier life, and ask about what he or she eats, and how is he or she playful, and how is the activities, either going to the school, or how is the environment of the school, and all developmental history you have to ask about it. After that, we can review the systems. In review of the systems, we will ask about the heat, any cough, rhinorrhea, pharyngitis, or any hoarseness. In respiratory system, we can ask about any sounds coming from the chest, like wheeze, any cough, and patient is also presented with the SOB, so we already know about that. In GIT, we can ask about any problem with the regurgitation, or any reflux, or any other tummy aches. In musculoskeletal system and derma, we can ask about any joint pain or any hemangiomas or other stuff. So next is the risk factors. Risk factors, we have to ask about the intubation, any previous history of allergies, any immune compromised condition of the patient, and any craniofacial malformation. These are important. So there is a one mnemonic which we have to used during the pediatric history. It's called the BINDI. B stands for the birth, I stands for the immunization, N stands for the nutrition, null history, and D stands for developmental, and E stands for environment. We already discussed all this stuff in the history outline, and but for the clear view, you can remember this mnemonic like BINDI. So there is another slide which I write for the post encounter. In the post encounter, they will ask you about the management of epiglottitis. So what is the management of epiglottitis? Because it is a emergency condition, so always assess for the airway, breathing and circulation. For airway, you have to check the comfort. There should be the comfortable position like head tilt, chin lift, jaw thrust, and remove visible foreign body if is there any, intubate if respiratory failure. For the breathing, we have to check for the oxygen level and administer the high flow oxygen if needed and monitor the pulse oximetry. And in circulation, we have to monitor heart rate, vascular access as needed. So if the patient is unstable and there are chances to be impending the respiratory failure, so urgently call to the anesthetist and ENT referral, ENT specialist, and intubate the patient. Do not examine the patient before intubation. So there is a pharmacological treatment also available. So in this case, broad spectrum antibiotic IV in IV form usually used. So ceftriaxone should be given IV. There is also some non-pharmacological treatment that educate the patient, mother or parent, whoever with the patient, and educate the parents regarding vaccination. If there is any lacking of the vaccination, then refer to the community center and they will discuss there and educate them. So this presentation was regarding the epiglottitis. Thanks for bearing me. Thank you so much.